Breastfeeding in the childcare setting, storage and handling. This presentation was compiled in collaboration with the Maine Roads to Quality program and the State of Maine Breastfeeding Stakeholders Committee. So how do I store breast milk, and how do I prepare the breast milk bottle? We know that breast milk is the best food for babies through the first 6 months of life and beyond. As a child care provider, it's necessary to understand not only the basics of breastfeeding and how to support breastfeeding within your setting, but also how to prepare and store breast milk. Training staff is instrumental in child care homes and centers to meet the standards of storage and handling of breast milk. This presentation will give you the basic tools needed to understand how to store and handle breast milk in your settings. The first step is to wash your hands before handling breast milk or any food source for yourself or the children in your care. The breast milk should be stored in a clean container that can include screw cap bottles, hard plastic cups with caps, or bags that fit directly into bottles. Each container of breast milk should have on it the child's name it is intended for, as well as the date, making sure to use the oldest express breast milk first, as breast milk does have a shelf life. When discussing thawing of breast milk, microwaves are not recommended to heat up breast milk, as they can unevenly heat the milk, leaving hot pockets in the milk that could result in burning a baby's mouth. You can heat up water in the microwave first and then place the container of frozen milk in the warm water bath to thaw. You can also run the frozen milk under warm water from the faucet to do the same. These are the Centers for Disease Control's current recommendations on length of time you can store breast milk in various areas. On a countertop, breast milk is good for about 6 to 8 hours, up to 77 degrees room temperature. In an insulated cooler bag, like a lunch bag, milk is usually good for about 24 hours, making note that you have ice packs kept in with the milk to keep it cool. In a refrigerator, milk should be stored to the back of the main body of the refrigerator for constant temperature, and it's good for about 5 days. In a freezer compartment of a refrigerator, so a freezer that is actually part of the refrigerator, like what you see in dorm-style refrigerators, those smaller refrigerators, milk is good for about 2 weeks. And then in a freezer compartment of a refrigerator where there are separate doors, so our normal everyday kitchen refrigerators, milk is good in the freezer portion of those for about 3 to 6 months. Then if you have a deep freezer, milk is good for about 6 to 12 months. Again, tend to store the milk towards the back of the freezer where the temperature remains constant. According to the Academy of Breastfeeding Medicine, milk stored for longer durations in the ranges listed is safe, but some of the lipids in the milk does undergo degradation, which might result in a lower quality of the breast milk. Make note that milk stored in the refrigerator will separate, so just make sure if the milk has done that and you're within your CDC recommendations of storage duration, just shake the milk up prior to heating to give to the baby. Breast milk has often been referred to as liquid gold. For mothers who are breastfeeding, especially working mothers who must pump to maintain their breastfeeding, every drop counts. Encourage mothers to store in 1, 2, or 3 ounce increments. Allows you, the child care provider, to add additional ounces to a bottle if needed, versus storage in 5 ounce increments and a baby is only taking 3 ounces, causing you to waste the additional 2 ounces. A good storage method for breastfeeding mothers is to measure ounce capacity of an ice cube tray and freeze breast milk in the trays, removing and placing the frozen cubes in a freezer bag with the date after they are frozen. It's also good practice to discuss with a breastfeeding parent how she would like to handle late-day feeds. If you notice a baby's feeding pattern is changing, discuss this with mom. Some mothers would prefer to feed their baby upon arrival to the child care center versus seeing a bag of their breast milk being thawed to give via bottle at the time of pickup. To find out where your facility currently stands in regards to infant feeding, I encourage you to take a look at the Let's Move Child Care Infant Feeding Checklist quiz. This is an initiative of First Lady Michelle Obama. The Let's Move Child Care initiative has 5 main goals. 1 is to get kids moving. 2, reduce screen time. 3, make nutrition fun. 4, offer healthier beverages. And 5, support infant feeding. The Let's Move Child Care Infant Feeding Checklist is available online at healthykidshealthyfuture.org. The Let's Move Child Care Infant Feeding Checklist is a self-assessment that covers the following main subject areas: breastfeeding education, breastfeeding environment, and breastfeeding policy. Utilizing this checklist is a good starting point for assessing your individual sites on current practices around breastfeeding and can help identify areas of needed improvement. If you would like to take a look at sample nutrition and feeding care plans, they are available in the 3rd edition of Caring for Our Children on pages 456 and 457. While here, I would also encourage you to take a closer look at Standard 4.3.1.3, which specifically addresses the preparation, feeding, and storing of human milk in the child care setting.